Okay, hello, and welcome to part 3 of this video series about tongue and lip ties. So I'm super excited to talk about this part. This is probably one of my favorites because I've learned so much about this with my first son Carter, and actually recently learned a new way to fix ties as well. Kind of on my journey as a postpartum nurse for the last several years, I've learned a couple of different techniques and things that you can do with ties as well. So lip ties. So we're gonna start with lip. Some things that you can do is just leave it alone. All right, not all lip ties are bad. Really, with my daughter, it made a little bit of a clicking noise, but she was able to transfer. So just make sure your breasts are feeling like nice and empty after. And as they get larger, they'll be able to slowly flip that lip up a little bit more as their mouth gets bigger. But really, and if they have a little bit of those lip blisters, it's like a couple weeks that they have that and it kind of goes away. Again, they grow out of it, their mouth gets stronger, it gets bigger. So that's not the worst thing. That's not like super affecting it, but you can always get it fixed. All right, so that's the one thing you can do. The next thing is you can get it clipped. Okay, so you can get it clipped by an ENT or a pediatric dentist. Woo. All right, okay, so that's kind of the two things that you can do with that. And really, that's really simple. The lip is super, what's the word? It's not easy, it's not as concerning for me when a baby has a lip tie because they can easily grow out of it. And unless it's like one of those stage 4 and they can't get that negative pressure seal around the breast, like if that lip is so tight and you constantly see corners of the mouth and they're getting air and they're not creating that seal and it makes them have a super shallow latch, then I would recommend possibly getting it fixed. So you can look in your local area. Literally, all I do is just Google, go on Yelp, search ENT for lip tie release and pediatric dentist. Off the top of my head, I do not have the medical terminology for a lip tie release. I know the tongue tie one because it's not as common, but basically you can find anything on Google, anything in your local area. You can also just call and talk to them and see if they accept your insurance or see if you can just pay for it out of pocket, if that would be cheaper, but definitely just call, ask some questions. Those people are phenomenal, and I always recommend a regular pediatric dentist instead of an adult dentist because they work with kids and they work with newborns, so they know what they're doing with that. Okay, and the different ways that they can clip it is either just by just scissors, sterile medical scissors, or by cold laser. This is the more common thing that a lot of pediatric dentists are doing. I don't know if ENTs have this in their office because it's an expensive piece of machinery, but they use the cold laser and it literally just zaps it. There's minimal blood loss. There's really no issue. So the cold laser I think is phenomenal and it's super quick. Like I said, there's less bleeding and everything too. So I highly recommend that one. That's what Carter had. Okay, so now moving on to the tongue because this is the huge one. Now I have 2 different columns for this. I have non-invasive, okay, and then I have invasive. Okay, so now what do I mean by that? I mean non-invasive means that you don't actually have to have a procedure. Having a cold laser or cutting it with scissors, that's a technical invasive procedure that they're doing on your baby. The thing is, these are less, even if it's a procedure and it's invasive, it's actually less invasive than a circumcision. Okay, like literally just, it's so much more minimal and the bleeding is minimal. It's very safe, and I just want to give you the education so you can figure out exactly what you want to do for your child if they have a lip or tongue tie. So I'm giving you all the options, and then you as a parent with your husband or your spouse, your support person, you sit down and really feel like, is this breastfeeding journey really, is this lip and tongue tie really going to affect my breastfeeding journey? If it is, your baby, when they're newborn, they will never remember it. Do tons of snuggles, skin to skin after. Yes, it's a little bit of a painful process after, once the local anesthetic wears off, because that's what they do local. But again, they're not going to remember it, and your breastfeeding journey you'll gain so much more from fixing it. All right, so non-invasive. I recently just learned this from my chiropractor, is you can do chiropractic care. Okay, basically body work. So my chiropractor is phenomenal. If anybody's in the surrounding Austin area, her name is Dr. Stephanie Gessner, and she's certified in the Webster technique with moms, and she does pediatrics, and she's phenomenal. She comes to my house. So I actually did an interview with her. So if you got that as an extra, that interview is phenomenal. I definitely recommend it. It was very eye-opening for some of the things that we talked about. And I really learned a lot about chiropractic care on babies, because I was literally thinking like they would crack babies just like adults. And I was like freaked out by that. And she says it's literally just these gentle pressure points that they kind of feel on baby. And what they'll do is she'll actually have you either kind of hold baby gently, and she'll work with your baby gently while you're holding them, or they're like kind of on your lap, right like this. And then sometimes they can go on her table too, and she starts right from a newborn. Really, the body work that she does helps release all that tension that some of those babies have from labor. Like if they had a super long labor, they were asynclitic or something like that, and like weird with the neck, they're gonna have trouble latching too. So really, I'm a huge fan of chiropractic work in pregnancy and postpartum, and for babies now through having my own experience with it with my children. I just think it's phenomenal what they do, and they really can try and get some of those things that we can't reach out with Western medicine, which is phenomenal. So really just trying to lose some of those things, they just touch these little pressure points that kind of loosen up the jaw, which can then help with the tongue tie, getting a deeper latch, more relaxed, have better tongue movement, not as tight in the mouth. So I really thought that was super cool. So just find your chiropractor. Again, what you can do is you can just go on Google and type pediatric chiropractor. And there's got to be one in your area. They're usually phenomenal. Just, you can call them up, see if you can read some reviews, how many babies have they worked with, things like that. And in the end, this is kind of like a double whammy. If you do chiropractic, is you actually have some other benefits as well. Like they have released tension, they can have better positioning with breastfeeding, it can help their gut, it can help with hiccups, like they can help their bowels move better and not be constipated. So there's a couple different things with that. And then the other one is cranial sacral massage, I think it's called. So I'm not gonna lie, I don't know too much about this, and I've never done it. I think it's one of those things where it's so non-invasive. It's like, does it really work? Again, I don't have my own experience with it. I really haven't researched a lot about it, and my chiropractor was telling me about it, and I'm just not 100% about it. I feel like if you were so nervous about doing anything, then this is where you can start, and then move up to her, and then move invasive. But I do actually kind of like a combination of both chiropractic and invasive, because you can work on that body work and that stress and that tension from labor and everything, and that positioning that they were in the womb for 9 months, and then have the invasive one too. All right, so those are the two things that you can do for non-invasive for the tongue. And then invasive is basically an ENT, same thing, ENT, pediatric dentist, and some plastics. And I know this kind of sounds weird, but one of the plastic surgeons at my hospital, he is phenomenal. I love him. His name is Dr. Cohn, and he actually taught me a new way of showing me a new way that he fixed lip and tongue, mostly just tongue ties, and I thought it was super cool, so I'll kind of share that with you. But you can see an ear, nose, and throat doctor in your area, pediatric dentist, or a plastic surgeon. Obviously, plastic surgeons are probably going to be a lot more money, so he just comes to our hospital and does referrals, and they go right through insurance. And he'll tell people if he doesn't accept his insurance, and he won't do it. So he's very nice about that. He's a very humble guy. So I appreciate that, because I'd rather people be upfront and honest about that stuff, and then not get the bill in the mail later. Because that's disappointing to me when you're not honest about those things, that it's like, oh, hey, now I got this bill in the mail for like $3,000 for a simple procedure. So like that would not be fun. All right, so what they're gonna do is they're gonna kind of do the same thing. They take little scissors, little sterile scissors, and they can cut it, and then you have the cold laser. Okay, so the scissors, and just some ENTs will just do scissors, and then they just cut it and let it go. Now what Dr. Cohn does from plastics is he does scissors, and then he also does a suture, which is such a great idea. Is he does a suture, he does one, so he clips underneath the tongue, and then he takes a dissolvable suture, and he makes one suture line right underneath where he cut in that area, so then it doesn't heal back together, which is like mind blown. I was like, oh, I wish everybody knew this technique because it's so cool. And literally, so that those sutures don't usually dissolve until like 3 or 4 days. If you've had any deliveries yet, you know they do them down vaginally after you have a tear. So they stay for a couple of days to really make sure that that skin heals, whether apart or together, and then in the couple days after that, they slowly dissolve in the body. So that is a super cool technique that he does that I think is phenomenal, because then you don't have to worry about exercises, and we're going to talk about that too. So now the cold laser, this is what I did with my son Carter, and it's basically the same thing, but it definitely has decreased pain, decreased bleeding, and it's super quick. It's super quick. So now for both, you're always gonna have local anesthetic. So don't worry, they're not gonna just do this without pain medication. So they do local anesthetic, and they let that sit for about 3 to 5 minutes, let it completely numb the area. Just if you were to get a root canal or something done with your teeth, they jab that needle up there, and they make your whole face go numb that you feel like you're gonna drool. They do that same thing with the babies. So to make sure that they can't feel anything, and you can ask to see these procedures and stand by, but there are a lot of people that won't. But my major thing with that when they use local is I always wanna make sure they're using the local and letting it sit long enough. I have worked with doctors where they just inject the local and then they start cutting, like it hasn't even absorbed into the baby's system yet. And it just makes me so angry, because it needs to sit. As an adult, we can scream and we can yell at them that it's painful, it hurts, like it hasn't set in yet. And babies just scream and cry and they just think it's nothing. So that's frustrating, and that's just what happens. So definitely ask if you can be there for any of those procedures. A lot of people will probably say no because of medical, not infringement, just lawyer things that you're going to sue them for something and whatever, and maybe videotape them. I don't know, but just ask. Laser, this is what I did with Carter. I was not there for the procedure, but let me just tell you a little bit about Dr. Cutlow, and he's in New York. So I can't remember his first name off the top of my head right now. It's Kotlow. So Dr. Cutlow, he's amazing, and he actually has 2 rooms set up in his pediatric dentist office, and you literally go into that room. You have to watch this video series first. He does an evaluation. They wrap him up in a swaddle blanket, bring him down to the basement. It's like a 2-floor. It's like a 2-floor building, and then they do the laser treatment down there. He brings them back up. Make sure you breastfeed before you leave to make sure it feels good, and then he shows you the exercises to do. Okay, just making sure my phone's not dying like it did yesterday. Okay, so some exercises. So what you're gonna do with this one is you want to make sure that you know when you bite your cheek, and within like a day or 2 you don't even notice it, it's like completely healed. Your mouth is so powerful at healing. It heals so fast. So think about that tongue. It's always down in your mouth when you're talking and when you're not eating and things. So those 2 pieces want to heal back together, okay? They want to heal back together. And when they do it the right way, you should see a diamond of like white kind of fascia at the bottom of their mouth to show the separation of the tongue tie. Dr. Cutlow really talks about in his videos that some people don't go deep enough and really make sure it's completely separated and has the full motion of the tongue that it needs to. And that's why you want to do those exercises. So he recommended to us, we used a tongue depressor, and he actually made a new tool for helping parents with, do exercises with lip and tongue ties, which I think is super cool. And he showed us exactly how to do the lip ones, is you just basically pull it up to the nose, do a couple stretches 3 times a day. And then the tongue one was hard, is you have to do that same thing. You have to reach around the tongue and really pull the tongue back. So we would use a tongue depressor and put it right at the top of the tongue and gently pull it back. I'm not gonna lie, that was the worst part about tongue ties, is that doing those assessments on our son, like Evan, I'm the more medical person, my husband Evan is not, so he held him when I was doing it on our son. He was screaming, he was crying. At one point it did kind of adhere back together and we had to pull it and kind of pop it, and it bled a little bit. And oh my gosh, we were both bawling. But then at the same time, I was like, I can't have this reheal back together. We lived in central Massachusetts at the time, and it was a 2-hour drive one way to Albany, New York to go see Dr. Cutlow. And I wanted to drive there because I knew he was like one of the best ones in the country. And I was like, we're only 2 hours away, like I'm doing it. So I was like, I'm not going back to get it done again. So I was like, we have to make sure we do these exercises, we do them right. And it was only like a week or 2 of that, and then we were done. We only had to kind of pop it that once, and then we were more adamant about pulling a little stronger each time and not being such sissies about it, because we wanted to make sure we weren't going to have to do that again. So those are the things that you want to do. If you just have an ENT that clips it and doesn't put an extra suture, you definitely 100% want to make sure you do exercises. And the video that I'm going to attach below of Dr. Cutlow at his office showing those exercises that you want to do are phenomenal. So I'm not going to do my own because he is the expert, and I'm going to link all his stuff down below. I want to give him credit because he is an amazing guy, and he's done so much research on this topic, and that's why I'm so passionate about it, because he was the one that helped me and my son in our breastfeeding journey. And that's why I want to share this with other moms, because sometimes lip and tongue ties go undiagnosed. If you have a pediatrician and they don't see moms nursing at the bedside, they don't know a lot about tongue and lip ties, they'll just look at it and they'll be like, yeah, it's fine. Yeah, it's fine. No, you can nurse right through it. It's super stretchy. It's super stretchy. I hear that all the time, and it kills me, because I'm like, yeah, it might be super stretchy, but it also might be decreasing their milk supply slowly, you know, and then they're going to fight it and everything after. So those are the different ways that you can do lip and tongue ties. Okay, the last thing I want to say about this is, you know what, I'm just going to write on the side, is triple feeding. This is going to be part of the lip and tongue tie feeding plan, is you want to triple feed, okay? If you go and you do this this process, and right after birth you latch your baby, and then you do an assessment right after, what you want to do is you want to start triple feeding right away if you notice a severe tongue tie. So if it's just barely a lip tie, I would say just keep an eye on it. But it's those tongue ties, definitely anterior, 100% you want to triple feed starting at birth. Posterior, if you're like questionable and you're on the fence, I would just start pumping after each feeding and triple feeding right from the beginning, because you don't want it to have such an effect on your supply that it takes your transitional milk longer to come in, and it affects you in the next coming weeks. And this is what really being proactive about it. So definitely I would highly recommend that. So that is the feeding plan that I will put below, and I will also put all of Dr. Cutlow's videos and everything down below as well. So again, reach out in the Facebook group if you have any questions about lip and tongue ties. If you feel like you had another child that had an undiagnosed lip or tongue tie, I feel you, because again, I searched and it took me 3 lactation nurses and finally paying a couple $100s out of pocket for a private consult to finally get this assessment and finding the answers to the root cause. And that's what I'm passionate about. I'm passionate about finding the root cause and finding a solution to help you still be successful in your breastfeeding journey. Because this is just another bump in the road. And once you get past it and you move forward, your breastfeeding journey is better. You can enjoy it more. You don't have to be stressed about your supply, and you have that peace knowing that you did something about it, and that your baby will benefit. Both you and your baby will benefit either way. So again, there's 2 different types, non-invasive and invasive. Lip tie I'm not as worried about, but definitely the tongues can be very tricky. So definitely reach out if you have any questions about that. Okay, hope you have a good day.